Imagine trying to build like a permanent structural dam inside the human body.
Right.
And now imagine trying to build that dam using a material that is 97.5% water.
Yeah, I mean, if you asked an engineer to do that, they'd probably just laugh and call it physically impossible.
Exactly.
Yeah.
But today we are actually looking at a microscopic hydrogel that does exactly that. And, it is fundamentally changing the daily reality for just a massive portion of the population.
It really is. It
Wow.
sounds like science fiction, I know, but this material is addressing one of the most, well, pervasive yet rarely discussed quality of life issues out there. I mean, it literally alters how people move, how they exercise, even how they socialize.
Right, so we are talking about stress urinary incontinence, or SUI.
Yeah.
For the 1 in 3 women who deal with this, the fear of a urinary leak is just this constant background hum. Like you're out for a morning run, hitting your stride, and you have to stop.
Or you're at the gym.
Yeah.
Right. You're setting up for a heavy deadlift, and you have to brace yourself in a way that just completely ruins your form.
Yeah, or honestly, you're just sitting around a table laughing with your friends, and suddenly you are like mapping out the quickest route to the nearest bathroom.
The psychological burden is just immense. And the standard medical advice for years has often just been, do more pelvic floor exercises.
Right, the classic Kegels.
Exactly. Kegels are great, obviously.
Yeah.
But for a huge number of patients facing actual mechanical tissue changes, they simply do not solve the physical problem.
Which brings us to the core of this deep dive. People are desperately looking for options that don't involve major surgery, right? And this minimally invasive urethral bulking system, it's called Bulkamid, has just been gaining incredible traction lately.
Huge traction.
So we've pulled together a massive stack of sources for you to figure out what is really going on here. We're looking at FDA clinical trial data, urology clinic guidelines, long-term European studies spanning over a decade, and real patient outcome reports.
And having this specific stack of data allows us to, bypass the initial marketing claims and look at the actual physiological changes occurring in the body over time.
Right. And our mission for you today is to answer one specific, highly crucial question. How long do the clinical effects of polyacrylamide hydrogel, that's Bulkamid, actually last?
Yeah, is this a permanent fix, or are we just looking at, like, a temporary Band-Aid that requires endless trips back to the doctor?
So, okay, let's unpack this.
Right.
Because to understand the longevity of the clinical effect, we first have to dissect the unique science behind the material itself.
Right, because the lifespan of the treatment is directly dictated by what we're actually putting into the urethral wall.
Yeah, let's get into the mechanics, because I gotta say, the word bulking just sounds incredibly medieval to me.
It really does.
It conjures up images of just, I don't know, packing some dense putty in there to block an exit. What is this material, really?
Well, it is entirely different from putty, thankfully. Bulkamid is categorized as a non-particulate, non-resorbable, homogeneous hydrogel.
Okay, that's a mouthful. Looking at the composition breakdown in our sources, my immediate thought is just absorption. You mentioned it earlier, it is 97.5% water. If I go to the hospital and get a saline injection, my body clears that water in a matter of hours. What is stopping the body from just drinking this hydrogel and flushing it out by the end of the day?
It's a completely logical question. I mean, the magic really lies in the remaining 2.5% of the material.
Okay.
That tiny fraction is a polymer called cross-linked polyacrylamide. So instead of a solid block of plastic, think of that polymer as a microscopic, three-dimensional spider web.
Oh, wow.
Yeah, it's this incredibly dense, highly structured network that basically traps all those water molecules within its silk.
So the water is physically locked inside this web structure, which prevents the body from just like absorbing it into the bloodstream.
Precisely.
Hmm.
And because the polymer is such a minor constituent of the overall volume, the hydrogel is incredibly soft.
Okay.
Its mechanical properties, its viscoelasticity or squishiness basically, it closely resembles the body's own extracellular tissue matrix.
Wait, let's define the extracellular matrix for a second, just so we're all on the same page. We are talking about the natural biological scaffolding that holds our own human cells together, right?
That is it, yeah. It is the environment our cells actually live in. And by mimicking that natural scaffolding, Bulkamid behaves completely differently from older historical bulking agents.
Right, because decades ago, doctors used things like bovine collagen, didn't they?
They did, yeah.
Which the body just recognizes as a protein.
Exactly. It sees it as food, essentially. The enzymes break it down, meaning the collagen degraded quite quickly, leaving the patient right back where they started.
That sounds frustrating. So you would be stuck going back to the clinic every few months just to replace what melted away?
Which is exactly why the medical field pivoted to particulate agents to try and find
Yeah.
something more permanent. They started using things like carbon-coated beads or um, solid silicone particles suspended in a temporary carrier gel.
Okay.
The idea is that the gel would absorb, and these permanent hard beads would stay behind to block the urethra.
But, I mean, dropping hard silicone beads into delicate urinary tissue, that just sounds like asking for an immune system freakout.
It was a disaster for many patients. The body's immune system sends specialized cells called macrophages to investigate these foreign invaders.
Right, the cleanup crew.
Yeah. So the macrophages try to eat the silicone beads, but they can't. They just bounce off. So frustrated, the immune system decides to quarantine the invaders by building thick, inflammatory scar tissue all around them.
And our sources mention things like pseudoabscesses and foreign body granulomas. You're saying the body is basically walling off the plastic like it would a severe infection, creating these painful, rigid lumps in the process.
That is exactly what a granuloma or pseudoabscess is in this context. It's a dense wall of angry immune cells and scar tissue. It causes severe inflammation and can make the urethra super rigid and painful.
Wow. So how does the immune system react to the microscopic spider web of Bulkamid then?
It essentially doesn't react at all. Yeah. When the macrophages come to investigate, they don't find a hard plastic wall to attack. They just encounter water suspended in a microscopic web. It doesn't trigger the alarm bells.
Huh.
What happens instead is remarkable. The hydrogel actually acts as a welcoming scaffold. It allows for angiogenesis.
The angiogenesis. Okay, so that's the creation of new blood vessels.
Yes. So these fine blood vessels originating from the surrounding periurethral tissue begin to naturally weave their way through the hydrogel network.
Oh, wow.
It doesn't get walled off, it gets adopted.
So it becomes a living, integrated part of the tissue wall. It's not just sitting there like a rock. The body is literally pumping blood through it.
Exactly. And because it integrates so seamlessly, it retains that vital squishiness we talked about. It keeps the urethra closed, providing resistance against sudden pressure spikes, like a cough or a jump, without turning the tissue into a rigid pipe.
Okay, the mechanics make sense. Now, because the polyacrylamide web itself is staple-like, our human enzymes don't have the tools to break down this specific synthetic silk. The logical assumption would be that the continence effect should just last forever.
Right.
If the dam never shrinks, you're cured for life. But let's look at the actual clinical timeline for women who get this procedure, because the data paints a much more, nuanced picture.
Yeah, we really have to separate the lifespan of the material from the lifespan of the clinical effect. The hydrogel is permanent, sure, but the human body holding it is not.
Right. And looking at the female SUI data, there is a surprising hurdle right out of the gate. While the material is totally stable, about 43% of patients require a second, top-up injection within the first 1 to 2 months.
Yep.
If the gel isn't shrinking, why are nearly half of these women going back for more after just a few weeks?
Well, it comes down to tissue trauma and precision. So when a doctor injects these 3 or 4 tiny deposits of gel to perfectly close the urethra, the needle itself causes localized swelling.
Oh.
The tissue gets inflamed and puffy, a condition called edema.
So the urethra looks perfectly sealed during the 15-minute procedure, but that is partly because the tissue is temporarily swollen.
Exactly. And doctors are intentionally cautious here. The absolute worst outcome of a bulking procedure is over-injecting, causing urinary retention where the patient is physically unable to pee at all.
Oh yeah, you definitely don't want that.
No. So they inject just enough to get a good seal, knowing the tissue is a bit swollen. When that swelling naturally resolves over the next 4 to 8 weeks, a tiny microscopic gap might reappear.
Got it.
For about 4 in 10 women, the doctor simply goes back in, adds a tiny drop more to that specific spot, and perfects the seal.
That makes a lot of sense. That explains the short-term adjustment period. But let's look at the medium to long term. Because when I dive into the clinic guidelines in our stack, specifically a report from the Birmingham Urology Center in the UK, they warn patients that effectiveness can actually deteriorate.
Yes, they do.
They state that while 70% of patients see significant improvement initially, that number drops to around 50% at the 2-year mark.
And, a 20% drop over 2 years sounds like a fairly steep decline for a supposedly permanent material.
It does, but to get the truly accurate picture, we have to look past a single clinic's warning guidelines and examine the robust, long-term clinical trials. I mean, Bulkamid was only FDA approved in the United States in 2020, but it has actually been used across Europe since 2006.
Yeah, we have an immense wealth of decade-long data from Europe.
And those European studies paint a much more durable, optimistic picture of the treatment's longevity.
They absolutely do.
Let's talk about the landmark 7-year follow-up data, because this is kind of the gold mine for answering our core question.
Right.
In this massive study, 7 full years after their initial injections, 67.1% of patients reported feeling either cured or improved. And we probably need to clarify what those terms mean in the literature.
Yeah, it improved usually means a significant reduction in leak episodes. So perhaps dropping from leaking multiple times a day to just occasionally during extreme exertion.
Right, but a full 30 to 35% of those women achieved complete dryness, like no pads, no leaks, total freedom, 7 years later.
It's incredible. There's also a really robust 3-year study validating those numbers, showing an 82% satisfaction rate maintained at 38 months.
Wow.
For a minimally invasive 15-minute procedure, sustaining those numbers out to nearly a decade is highly significant.
It is. But I have to play devil's advocate here. If the hydrogel web is essentially permanent, and we know it successfully integrates into the tissue with native blood vessels, why does the clinical effect fade for that remaining 30 to 50% of women over time? Why isn't it just a 100% cure rate forever?
Well, it gets to the core of how human biology works against gravity and time. The gel plug maintains its exact volume, yes, but the surrounding physiological environment is constantly evolving.
Meaning the plug stays the same size, but the hole around it might be changing.
Exactly. As we age, our pelvic floor muscles naturally weaken. More importantly, hormonal changes, specifically the dramatic drop in estrogen during and after menopause, fundamentally alter the elasticity, thickness, and blood flow of vaginal and urethral tissues.
Right.
The native tissue surrounding the gel just slowly thins out and loses its tone.
So the initial bulking effect prevents urine passage based on the volume injected at that specific snapshot in the patient's biological timeline. When they're 45, it works perfectly. But by the time they're 52, their surrounding tissue has atrophied, creating new, tiny gaps around the permanent gel.
That's it. And the tremendous advantage here is that because the polyacrylamide material is safe and because it hasn't caused a rigid wall of inflammatory scar tissue.
You can just go back in.
Exactly. The doctor can simply go in and add another small top-up injection 5 or 7 years down the line. You just compensate for those age-related tissue changes as they happen.
So the material is permanent, but you are not. Your body keeps changing.
Right. So for women with stress urinary incontinence, we can firmly say Bulkamid offers durable relief for roughly 3 to 7 years, often longer, with the possibility of simple, safe top-ups to maintain the effect.
That's a fair assessment.
But we have been entirely focused on female anatomy so far. Let's pivot to the male data because, does this longevity translate to men?
It's a great question. We established that Bulkamid relies on integrating with the surrounding tissue wall. But what happens if that tissue wall has been surgically altered or severely damaged?
Right.
This completely changes the game for men who typically experience incontinence not from natural pelvic floor weakening, but as a direct result of prostate surgery.
Yeah, we call this post-prostatectomy incontinence, or PPI. The anatomy and the root cause of the leak are entirely different. We are talking about potential physical damage to the sphincter muscle itself during the surgical removal of the prostate gland. When a surgeon removes the prostate, they're working incredibly close to the urethral sphincter. Even with robotic precision, the sphincter can be stretched, scarred, or have its nerve supply compromised.
Ouch!
Yeah. The physical gap that needs to be closed is often much larger, and the mechanical pressures involved are just different than in female SUI.
Which really explains why the timeline for men is notably bleak when looking at bulking as a primary treatment. Looking at the clinical data for men using Bulkamid as a standalone fix, it's only modestly successful. We are looking at around a 33% improvement rate initially.
A hydrogel simply cannot hold back the tide long-term when the structural integrity of the sphincter has been compromised to that degree.
Our sources reference a major Medicare study that really highlights the struggle here. Over 52% of men who received a bulking injection required a repeat procedure or converted to a major surgery within just 1 to 2 years. Think about what that means for a patient. You undergo the procedure, you have a brief moment of hope that the leaking has stopped, and within a year, you are right back in the doctor's office facing the prospect of invasive surgery anyway.
It is an incredibly frustrating cycle. The data strongly suggests that for male PPI, Bulking is often just delaying the inevitable need for a structural fix.
But, and this is interesting, the data also reveals a fascinating pivot. Bulkamid isn't totally useless for men. A clear pattern emerges when we look at how it performs as an adjunct therapy.
An adjunct meaning it is used in combination with another primary treatment.
Right. Let's say a man has a surgical sling placed like the Advance XP sling. The surgeon places this synthetic mesh to structurally reposition and compress the urethra. But over time, maybe a year or two later, the man starts experiencing minor leaks again as tissues settle.
It happens.
Instead of undergoing another major operation to replace the sling, doctors can inject Bulkamid to essentially tighten up those tiny remaining gaps.
And in those specific adjunct cases, the data shows an impressive 80% improvement in continence. The sling provides the heavy structural lifting, and the hydrogel provides the precision sealing.
It is a massive statistical jump. I mean, 33% success on its own, but an 80% success rate as a helper to a sling.
Yeah.
It perfectly illustrates how vital customized medicine is. You cannot just declare a treatment universally effective. The exact same microscopic spiderweb behaves completely differently depending on the mechanical environment of the body it is placed in.
You really have to match the physical properties of the treatment to the specific architectural failure of the patient's anatomy.
Absolutely.
Yeah.
So this brings us to the ultimate trade-off, and arguably the most fascinating part of the data stack for me. We know the clinical effects of Bulkamid might fade over a few years. We know it has a success rate hovering around 64% to 74% for women, depending on how strictly a clinic defines success. So the glaring question is, why wouldn't a patient just choose a more permanent, highly effective option right from the start?
You're referring to midurethral slings for women.
The tension-free vaginal tape, or TVT, yeah. Our sources universally call these slings the gold standard for a reason. They boast success rates up to 80 or 90%. That is a structural, highly permanent fix. If a patient's goal is to stop leaking, why not just go with the gold standard that works almost every time and rarely needs a top-up?
It is the most rational question to ask from a pure efficacy standpoint. Okay. But when researchers actually talk to patients, the logic flips. The World Federation of Incontinence and Pelvic Problems cited a study called Voice Your Choice.
Oh.
They presented women with all the efficacy statistics, the timelines, and the pros and cons of both slings and Bulkamid.
And the majority of women still actively chose the bulking agent, despite knowing it had a lower success rate and a shorter lifespan.
They chose it overwhelmingly.
Yeah.
And it basically comes down to a deep analysis of safety and lifestyle impact.
Let's talk about that.
Let's look at the lifestyle aspects, specifically downtime. A midurethral sling is an invasive surgical procedure. The surgeon has to make incisions in the vaginal wall to place a synthetic mesh tape under the urethra and often thread it up behind the pubic bone.
Wow. And the recovery for that is intense. Patients are typically looking at a strict 6-week recovery period. During those 6 weeks, you are heavily restricted from lifting anything heavier than a gallon of milk, exercising, or engaging in strenuous activity.
Right.
For a busy mother or someone whose mental health really relies on physical fitness, 6 weeks is a massive disruption.
Huge. Now compare that surgical reality to the Bulkamid procedure. It takes roughly 10 to 15 minutes. It's routinely performed in a standard office setting under local anesthesia.
Just local?
Yeah. There are no incisions, no cutting of tissue planes, and patients are typically cleared to return to all normal activities within 24 hours.
The difference in downtime is just wild. There is actually a patient testimonial in our sources from a woman in York in the UK. She was an avid weightlifter whose training was constantly derailed by SUI. She went into the clinic, had the 15-minute Bulkamid procedure under local anesthesia, walked out, and that very same evening she went to the gym.
Wow.
She hit a personal best in the heavy deadlift without a single drop of leakage.
That anecdote perfectly encapsulates the lifestyle appeal.
Yeah.
I mean, you don't have to put your life on hold. Yeah. But the second factor, the safety profile, is perhaps even more compelling for these women. Slings are highly effective, yes, but they carry inherent, unavoidable surgical risks.
They do. The clinical data lists a 3.8% risk of bladder perforation during the sling placement. There is a 4.1% risk of urinary tract infections, and then there is a 3.4% risk of complications severe enough to require a laparotomy-like and open abdominal surgery just to fix the complications of the first surgery.
And even beyond the operating table, there are long-term risks with synthetic mesh slings. The mesh can sometimes erode through the vaginal wall over time, causing severe pain, or it can be placed slightly too tight, leading to permanent difficulty emptying the bladder.
That's terrifying. Now, compare that daunting risk profile to the hydrogel. Over 50,000 Bulkamid procedures have been performed globally. In all of those procedures, there have been zero reported long-term complications.
Zero.
No mesh erosions, no permanent urinary retention, no foreign body granulomas. The absolute most common side effects are a mild, temporary burning sensation when urinating, or a temporary slow stream that resolves in a day or two.
When you hear zero long-term complications, it completely reframes the patient's decision-making process.
It really does. There's also a strategic element to this safety profile that our sources highlight, which is the concept of future-proofing.
Right, not burning your bridges therapeutically.
Exactly. When you get a surgical sling, you are structurally altering your anatomy and introducing scar tissue. But because injecting a 97.5% water hydrogel is so minimally invasive, you preserve your future options.
Right.
You can still safely carry a pregnancy and have children after the procedure. And crucially, if the bulking agent does fail after 3, 5, or 7 years, you haven't ruined your anatomy. You can still easily opt to get the surgical sling later if you decide it's necessary.
Yeah, you haven't permanently altered the delicate tissue planes in a way that makes future surgery significantly more dangerous or technically difficult for the surgeon.
So the data reveals a massive shift in patient psychology. Patients are actively and consciously preferring a less invasive therapy, even when fully understanding the lower statistical success rate and even knowing they might need to schedule a repeat procedure in 3 to 7 years.
Yeah.
They are fundamentally choosing a low-risk profile and an immediate return to their lives over a permanent structural guarantee.
So, to synthesize all of this data and return to our core mission, how long does Bulkamid actually last?
Right. If you are a woman dealing with stress urinary incontinence, the extensive European data shows it offers durable, highly meaningful relief for 3 to 7 years, and often longer. You just have to be prepared for the possibility of a quick top-up in the first month as tissue swelling resolves, or a maintenance injection years down the line as menopause changes your native tissue.
Exactly.
Now, if you are a man dealing with incontinence after prostate surgery, the standalone window is much shorter, usually a frustrating 1 to 2 years. For men, it truly only provides lasting relief when used as a precise tool to boost the effectiveness of an existing surgical sling.
Immersing ourselves in this data leaves us with a really provocative philosophical shift regarding how we view modern medicine.
Oh, how so?
Well, we have been deeply conditioned to seek the permanent structural cure, right? If a pipe is leaking in our house, we want to rip out the drywall and install brand new permanent copper hardware.
We want to fix it once, endure the demolition, and just never think about it again. That is totally the surgical sling mentality.
Exactly. But human bodies are not static plumbing systems. They naturally age, shift, thin out, and change over time.
Yeah.
So perhaps the most rational approach to these deeply personal quality of life issues isn't a permanent, irreversible hardware installation. Perhaps it is low-risk, renewable maintenance.
Well, wow. By embracing treatments that we can gently top up and adjust over the decades, treatments that literally invite blood vessels in and integrate with our own tissue rather than fighting it, we might be aligning our healthcare much more closely with the natural, evolving state of the human body.
It is a profound shift from trying to conquer our biology to collaborating with it.
Renewable maintenance instead of permanent hardware. I love that. So the next time you are out for that morning run, setting up for that heavy lift, or just trying to enjoy a laugh with your friends, you don't have to just brace yourself and accept the fear as a permanent condition. There are highly advanced, adaptable options out there that can evolve right alongside you. Thank you for joining us on this deep dive. Keep questioning the world around you, and we'll catch you next time.